morning to one and all of you, and thanks a lot, Dr. Sri Ganesh and Supriya and the entire team for this wonderful opportunity. I think we have heard a lot about Vivinex Impress, the different surgeries which were shown and discussed in the last hour. But let me get to you to the very basics and something it's important to be reiterated at once again. So basically, what we all have come to understand very, very clearly, that a patient knows that we have all the technology to give him great freedom from glasses and also a good quality of vision. So he just wants to know which would be the lens of choice for him. So in other words, when we are talking of doing a premium IOL surgery, we are no longer talking of vision restorative, but it has become vision enhancing procedure. So the reason is why, what do we choose, is because of the range of lenses we have. We could just give him a straightforward monofocal lens and do a mini monovision correction and still keep him happy. We could do a monofocal, enhanced monofocal as the different lenses which are there, which are available, one of which a very popular one I would be talking to you. We could look at the EDOF. Now, EDOF is different from enhanced monofocal because EDOF gives you a good intermediate range of vision, more significantly than the enhanced monofocal. Then there's a hybrid combination wherein the multifocal is there with an EDOF combination, and then comes the trifocal lenses. So when you talk of EDOF, I'm just going to briefly tell you, there is one which corrects a spherical aberration and gives you that extended depth. There is one which has a pinhole aperture in the center, which gives you that extended depth. There is one multifocal which gives lesser ad for near and thus gives you that EDOF feeling. There is one wherein there is a low near ad, but also there's a manipulation of spherical aberration, which gives you that extended depth. And then there is the central optical zone, which is modified as in Vivinex Impress, which is what I'm going to discuss with you today. Before we go further on, let's understand how does multifocality work. It works on the principle of simultaneous vision. While one object is in focus, there is one out of focus image which is there, and it is that out of focus image which is causing the glare and the halos. We also need to remember, while you're talking of premium IOLs, that the human eye is not multifocal. So what we are trying to create is not physiological, but how best we can make this patient adapt to a multifocality is to ensure that there is less loss of light and more light from the optics is being utilized by the eye. We have come a long way as far as the foldable IOLs are concerned, from getting an aspheric profile to the haptic design to the pigment, yellow pigment, and the PCO prevention with a square edge. But where we needed the enhanced monofocal and why it came forward was all of us started needing something in the intermediate vision which had to be corrected. So the enhanced monofocal came with a concept that the optical principle of these lenses have to be altered. And then they looked at all the tried and tested platforms. And then, which would be the platform to look at? Look at a platform which is so sturdy and stable as the Vivinex platform, which we already know is so biocompatible, is giving you great quality of vision. But the important thing to note here, it is glistening free. Now, what do you mean by glistenings? These are small micro vacuoles which are being created within the intraocular lens while it is in the aqueous humor environment. And what is happening is, there is a water and a polymer, IOL polymer interface. The water's refractive index is 1.33, and this of the polymer is 1.55. So there is going to be refraction, there is going to be scattering of light because of these micro vacuoles or glistenings, which have been seen in PMMA and other good company lenses too. But what Vivinex promises you is a glistening-free lens. And this has been studied by various analysis by others who have found that this definitely has a very much enhancing optical clarity. So that is one basic reason to look at Hoya Impress. The other thing is, we all know that even if you're going to place your lens into the capsular bag, there is a 0.4 to plus minus 0.2 of it being off axis. And this small degree of off-axis is what creates a small amount of coma or a drop in vision. So what ingenious idea this lens came up with, the Vivinex Impress, was it had some elements in its subsurface, which one of it created a positive coma if the lens is off axis, and the other element created a negative coma which is off axis. So what happened, if there is a small amount of coma, these two elements neutralized it. And this is another study wherein they compared the Vivinex Impress with the other competitive lens in the market. And they found that also, although the Q value was 0.18, the ability to tolerate decentrations was very impressive in the Vivinex Impress. The other quality which we need to understand is the reduced PCO. One, we know it has a square posterior edge which prevents the lens cell migration. The other thing, the haptic, which was repeatedly told to you over the course of the day, is rough and textured. So what it does, besides allowing to sit comfortably stable in the capsular bag, it also doesn't get stuck on the optic when you're injecting it. And if it is stuck on the optic, we need to use two instruments to separate it. We are over anxious. We shouldn't create a dialysis or a PCR. So that is totally being obviated by having this textured haptic. It has a smooth, regular optic surface, which again is PCO prevention. And the most important thing, it has an unique active oxygen processing treatment on its posterior surface, which prevents PCO occurrence. So then, going on to the enhanced monofocal component, we know the standard monofocal gives great vision for distance, but the Vivinex Impress gives you that extra intermediate vision. So when you look at the optic of these lenses, what it has, which is all not on the surface is smooth, that central optic of 2 millimeter. The subsurface, there's a low convex and a high convex area. Besides the fact that the peripheral aspheric area is also causing convergence of rays, this low convex and high convex in the subsurface is also converging the rays to give it that extended depth of focus which is needed. Now, while it is giving you that extended depth of focus, even if these patients were to have a small residual error, the beauty of it is it doesn't visually impact these patients. So even if a small residual error, they continue to be happy, which is a point to note. This was another study which looked at how these Vivinex Impress lenses performed in scotopic pupil, mesopic pupil. There is varying pupil size and varying axial length. And it was seen that these lenses continue to have that 1.1 line extra advantage of intermediate vision in all these patients. This is again a study which has compared a series, multicentric study, which compared a standard monofocal with a Vivinex Impress. And again, it showed that in that intermediate 66 centimeter vision, it gave a 1 to 1.5 defocus. In other words, it gave you a gain of more than one line of intermediate vision, which is a point to note. Again, this lens was compared. We didn't give up there. Compared it with Isopure, you compared it with iHands and Impress, and it was seen that whether it was the point spread function, whether it was a lower order aberration, the higher order aberration, the spherical aberration, or the ocular surface index, all of these three lenses were comparable. Then the very interesting thing, I'm not going to go into great detail, is the preloaded injector system, which allows a very smooth controlled delivery, which you all saw in the surgeries. And the most important thing, it has an insert shield. Insert shield is a shield which you just push forward, which allows you to either inject the lens at it has a shield which keeps the length of the plunger at 6 millimeters, goes straight in the capsular bag. But supposing you're a beginning surgeon, you don't want the lens to just go open into the bag. You want it smaller, then you can push the shield forward so that the lens will open into the anterior chamber and you can gently dial it into the bag. Another beautiful thing is if it were a hyperope. And in a hyperope, the AC is small, shallow, so you don't want the lens to go just plunging into the capsular bag. This shield, when pushed forward, would be an advantage. I'm not going to show the video due to paucity of time. And another interesting thing is it has 1.7 is the diameter of the injector tip. So you can just have a 2.2 millimeter incision to go ahead with the surgery. So then, what are the primary indications of Vivinex? One,
any active person who doesn't want a multifocal but wants some reading advantage, some intermediate advantage, and due to some reason he cannot put a multifocal, like he has a macular pathology or an early moderate glaucoma, Vivinex Impress is going to be the answer. So what do we understand? It is a supernormal, super monofocal lens. It has a broader landing zone, great distant vision, extra line for intermediate vision, and it has no dysphotopsia and glare. That is, it is comparable to a standard monofocal. I'm just going to rapidly show you 3 examples. Now, this is a case of a high myo, -11 and -8.5. So then, by pre-op, his vision was poor. We went to the Barrett Universal TK and gave him a +6 and a +7 in each of these eyes. And look at his vision. It is plano 0.5 cylinder, 6 by 7.5 in both eyes. But you want to look at his intermediate vision is N10. Imagine a -11 and a -8. He gets an intermediate vision of N10 and near plano. So that's brilliant. Now this is another case of one eye, his standard monofocal has already been implanted. The patient has a small cylinder but needs a +2.5 add. Because the patient wants something different in the other eye, a little more intermediate vision, you can go ahead and put an Vivinex Impress in the other eye, and then there's 618 vision. Look, and now he has plano 6.6 and a near vision, intermediate vision, a near vision of N8. Now that's brilliant. Now this is another case. Patient has very early cataract in one eye, cataract in the other eye, which needs surgery. And he says, we decide that we're going to put a Vivinex Impress for that eye. And look at him, 0, plano 6.6, but N10. So the last question you can ask, you say N8 in one case and one N10 in the other case. The beautiful explanation which was told to me by one of the Hoya technique guys was, that's brilliant, you know, whenever you want to implant a lens, you should really drill them to know all the plus and the minus points. Like the cornea has spherical aberration, we all know, which could be any value and which is countered by the negative spherical aberration of the lens or the positive spherical aberration of the lens. We are not sure that some of these patients would have had a little extra aberration on the cornea, because of which that became N8 or N10. I would have explained to you much greater detail, but paucity of time. So I think we need to understand with the content of my talk in the last 10 minutes that Vivinex Impress makes a happy patient. Thank you very much.
Thank you, Dr. Chitra, for talking about extended depth of field lenses.